afternoon. My name is Christine Arsenault, and I will be presenting an informative speech on anxiety and the disorders. The title of my speech is Anxiety Takes on Phases. My general purpose is to inform you of the many different types of anxiety disorders. My specific purpose is to describe anxiety and the disorders and to inform you of the symptoms and treatments. Anxiety is a general term for several disorders that cause nervousness, fear, apprehension, and worrying. These disorders affect how we feel and behave, and they manifest real physical symptoms. How many of you have experienced anxiety, whether it be mild or severe? Whether it is mild anxiety, which is experienced when we are confronted with challenging tests or an interview, or severe anxiety, which is more serious and can be debilitating and can seriously impact your daily life. In 2010, research conducted by the National Institute of Mental Health has shown that anxiety disorders are one of the #1 mental health problems in American women and are the second to alcohol and drug abuse among men. Nearly 50 million people in the U.S. have suffered from panic attacks, phobias, or other anxiety disorders in the past year. That's an astounding figure. I want to discuss this topic with you today because I personally deal with anxiety. I go through different levels of generalized anxiety disorders depending on the day and the situation, which I'll explain generalized anxiety disorders later. I would also like for you to understand the different disorders and know that all can be managed with the right treatment and medication. Today I will share 5 types of anxiety disorders. Each I will give you definition, explanation, symptoms, and treatments. The first one being panic disorder, which in short is a sudden episode of acute apprehension or fear. Another type of disorder is obsessive compulsive disorder, which means recurring thoughts, patterns, or behaviors. Post-traumatic stress disorder is a disabling psychological symptoms following a traumatic event, mainly tied to soldiers who have experienced war. Social disorders is a fear of embarrassment, of humiliation in social situations. Generalized anxiety disorder is chronic anxiety that persists for more than 6 months. Now that I've given you a list of these disorders in a short definition of each one of them, I would like to go into a little bit more detail and explain the symptoms of each one. Panic disorders can be triggered by anything that makes you anxious. Normally, you experience brief, sudden attacks of intense terror. You experience trembling, shaking, sweating, breathing really fast, and it usually lasts no more than 10 minutes. Obsessive compulsive disorder are noticed by actions of repetitive nature, um, superstitious behaviors, like walking in a certain pattern, or having towels or cans lined up in a certain pattern or number of cans in a certain area of your cabinet. You may also experience washing hands repetitively or checking your locks repetitively. Post-traumatic stress disorder is recurring memories or nightmares of a traumatic event. This disorder is mainly associated with veterans who have experienced traumatic events while serving, if you've had a traumatic life experience. These type of disorders also come with sudden noises that make you jump, thinking you're always in danger, experiencing a sense of panic that something bad is about to happen. Also fear. Social disorders is an intense fear of certain social situations. Most people will isolate themselves out of that fear, so it can be a very lonely life. Social disorders comes with a lot of fear of being scrutinized, using public toilets, fears of being in crowds, Generalized anxiety disorder is a fear of not being able to cope. It's difficult concentrating. You have a fear of failure. You have a fear of rejection or abandonment. You worry and you overanalyze. You think, and you can sometimes it can sometimes turn into a panic attack. If you notice, the word fear appears in most of these disorders. As they say, the best way to deal with fear is to face it. And some of the treatments help you face those fears. Some of the most common treatments in these disorders or relaxation training. In panic disorder, relaxation training meaning abdominal breathing. If you're feeling yourself getting fearful of certain situations, it's advised to just kind of help yourself breathe yourself out of that situation. Specifically, also with panic disorder, lifestyle and personality changes are suggested, meaning regular exercise and eliminating stimulants such as sugar in your diet. Obsessive compulsive disorder also comes with abdominal breathing. Specifically with obsessive compulsive disorder, you are exposed, and exposure and response prevention is recommended. Exposure to situations that aggravate your obsessions. For example, if someone is obsessed with maybe not shaking someone's hand, or obsessed with having certain cans lined up in a certain way, or towels lined up in a certain way, that form of treatment would be to kind of face that fear and maybe one day have those cans disorganized, and see how you go throughout the course of the day with thinking that those cans are disorganized. And post-traumatic stress disorders, there's always a recommendation for support groups. And also there's exposure therapy, meaning a therapist or a support person helps you confront your fearful situations you may want to avoid. Social disorders is also an exposure treatment, where you gradually and incrementally face the social situation that you're afraid of. For example, if you're afraid of going to a party, or if you're afraid of maybe being in a crowd of people, you would maybe start by going somewhere with another person in that crowd, just to kind of gradually deal with that fear. In generalized anxiety disorder, the treatment for that is normally cognitive behavior therapy, where the fearful self-talk that you experience is underlined by specific worry themes, and they are challenged and replaced with more realistic thinking. With generalized anxiety disorder, worry exposure is also recommended. You repeat the prolonged exposure to the fearful images of what you're worried about. For example, if you're worried about maybe anticipating a phone call, or you're worried about bills, or you're worried about any situation that may trigger your anxiety, you think about what will really happen if that doesn't happen. If you don't get that phone call, if you can't get that bill paid, that makes you worry. You think about what will happen. Most of the time, nothing. So when you think about it and you breathe yourself out of that situation and calm down, most of the time you'll get through the day. So in conclusion, with all of these disorders, there are circumstances that trigger them, but they all can be managed. I've talked about the anxiety and the mental disorders associated with it. I hope you have grasped a better understanding of what these disorders are, and most importantly, how or if you can identify with them. It is very important for me to inform you of these disorders, because you may know someone who may be suffering, but you were not sure how to handle them or what to do. So what I would like for you to take away from this speech is that if you're not sure how, if you see someone maybe moving in a certain way or acting a certain way, and you're not sure why, they are sad, depressed, anxious, withdrawn, ask What are they really feeling inside? And how can I help them get through it? Thank you so much for listening. I appreciate your time and have a stressless day. Thank you.